The 1 million doses will arrive at OR Tambo from the Serum Institute of India. It is expected that a company responsible for storage and distribution will be announced in the coming days. But just how safe will the COVID-19 storage be? Joining us now to tell us how the government plans to safeguard the distribution of these vaccines. We speak to now Rob Botha. He's from the Department of Health, Logistics and Technical Unit. Mr. Botha, thank you very much for your time. So that's the question right there, embedded in that introduction. How safe will these vaccines be if they are not barcoded? Do they not, do criminals stand an opportunity here? For example, to take more than what they're supposed to, if indeed criminality does creep in?
Good morning, and good morning to your viewers. Yeah, obviously a big concern, and I think everybody is thinking about this. As you rightfully say, the first batch of vaccines that we are receiving today will not have barcodes on it. The idea, however, that a barcode prevents theft is not entirely accurate. What the barcode does prevent, well, it does enable, it enables us to track and trace the product through the supply chain. It gives us the ability to actually identify the product and verify that it is the product that we're expecting to be using. So the fact that there are no barcodes per se does not necessarily prevent theft from happening.
Yeah.
Obviously, there are security measures that are being put in place, which I can't really go into details about, but to secure the transit as well as the storage of the product. And then the idea of reconciling what has been issued versus what has been vaccinated is where we are going to be keeping control.
Well, some people will have a problem, Rob, around government's caginess, if I could call it that, about the security of these vaccines. If they're not barcoded, people worry that they're going to be vulnerable to thieving. But you speak about tracking and tracing, but you also say you're not going to go into detail about the security around that. Well, briefly then, what will be involved in this tracking and tracing to make sure that the people get jabs that are intended for them and not more than they're supposed to get?
So in the first batch that is coming in, as has been reported, is we are having a fairly closed loop of recipients, being the healthcare workers, with designated sites where the product will be delivered. So we have the list of where they are going. Okay. At the receiving side, there will be a link between the patient or the recipient that is receiving the vaccine together with the vaccine that they're receiving. Understanding that this first batch is literally that. There's only one batch, so there aren't multiple batches, and there's only one product in the country at this particular point in time. So for now, without the barcode, which wouldn't have solved that problem, there is only one that is available now. As I said, the security around it links to storage, it links to the transporting and the security associated with that. So there are measures that are being put in place around the physical security of it. Yeah. As I say, a barcode on a product doesn't prevent theft. Okay. What it does do is it enables you to identify it.
Yeah. Talk to us about the concerns around public health facilities, the number of people, whether it be opinion makers or even reports as well, news reports suggesting that public health facilities are particularly vulnerable to the theft of medicines. How prevalent is the situation, and what can be done to make sure that these COVID-19 jabs are not vulnerable to the same issue? I know I'm asking you the very same question, but these are major concerns that I think you've got to allay public fears about.
I hear you, and I hear the concerns. The prevalence of issues in public sector facilities, I can't talk to that. However, as I said, the only way that we have at the moment is to be able to say how much stock has been delivered to a particular site. And then using the EVDS system, which is the system that's going to be tracking the number of patients that are being vaccinated, is a retrospective reconciliation to identify if there are potentially any gaps in the supply chain. So we'll be able to pick it up retrospectively, but going forward is a challenge.
Yeah.
We are making sure that the products are being managed through the pharmacies in the first phase, so that we have the controls that would ordinarily exist there. And those products are being managed using the systems that are in place.
Yeah.
The most important thing in both the public and private sector is to be able to understand the stock on hand, and then, as I said, reconcile it back to what vaccines have actually been administered.
There's another important element, Mr. Botha, and it has to do with falsified jabs being prevented from entering the supply chain. Is that a real threat, and what is being done to circumvent that?
Yeah. So as a country, if you have a look at barcoding worldwide, and most of the drive around it, and believe you me, I'm a big proponent for this because I believe it definitely assists the supply chain. If you have a look at it in most countries where this has been implemented, it is to assist to avoid falsification or counterfeit product, for want of another word, entering into the supply chain. We have very stringent rules and regulations in our country. That means that, and we don't say that it doesn't happen, but that means that the amount of falsified or counterfeit product in our country is next to zero. Our regulator has put in stringent measures to avoid that. Recently, as part of the supply chain exercise, we've also made sure that there's a separate tariff code for COVID-19 vaccines, should they be coming in, so that we can get that visibility and quickly identify it.
Yeah.
Measures are being put in place so that empty vials, for example, cannot be recirculated into and refilled. So those things are being put in place as part of the training and the field guide being used for the rollout of this vaccine.
Yeah. All right. Rob Botha, we're going to talk to you a whole lot more, I'm sure, in the coming days, as these vaccines that will land today are going to go into a quarantine, a quarantine of sorts, if you like, for about 10 to 14 days. So, for example, we're going to talk to you about the process of registering to make sure that you get that vaccine. These are all the questions that are going to come up for you. But thank you for today.